So this is called a palatal expander, or we also abbreviate it as a PE. This widens the upper arch, which helps with the crossbite, and it helps with crowding as well. It also redirects eruption of the teeth into a wider arch, and it corrects misaligned back teeth caused by an overbite. It also eliminates thumb or finger habits, just because that thing is in your mouth, so it helps with that. So turning every night for 6 weeks. So turning it, you basically see this little hole in the middle of the bar on the roof of the patient's mouth. And what you do is, this is the key, put it in the hole, and then you could tell if it's like standing up by itself like that. And then to do one turn, you push it down and then out. Do not push it back up. Sorry, this is a fake person, so like that. So when you see the next hole right there, that means you did one full turn. So that is how you do the turn. So after 6 weeks, that's when you should be coming in to check if the expander has been turned and if you need more turns or if we stop you there. So that's how we kind of evaluate you at your next appointment. With the expander, patients usually feel really weird talking. They feel like they have a lisp. It's just because the tongue is kind of getting used to the expander on the roof of their mouth. Try not to play with the expander or put your fingers in your mouth or mess with the expander at all. I know it's really weird in your mouth, but you don't want it to get loose or broken and have you uncomfortable, which is not fun. So try not to put any fingers or play with the expander. Cleaning the expander, there is a lot of metal in between your teeth there, but brushing it and having extra time around the expander works great. So just focus a lot around the expander, small circles when you do brush your teeth at night and in the morning and during the day, and just try to go in there. Sometimes it's hard to floss, but try to get your floss in between there, but cleaning it regularly 2 to 3 times a day is perfectly fine. We also give you extra fluorinated toothpaste that you are provided at your first appointment, so be sure to use that as much as you can just to prevent cavities. We have 3 different flavors, so you could choose whatever you want. Just let your assistant know, and then if you ever run out, just let us know and we could give you a new tube.